2022, Year of Vaccination. According to a respected specialist, if 2021 was the year of vaccine development, 2022 would be the year of vaccines and booster shots. The year of vaccination will be 2022, said Jerome Kim, Director General of the International Vaccine Institute, an independent nonprofit dedicated to vaccine research for poor countries. On Monday, Kim told CNBC's Street Science Asia that he hoped this year would be the year when anti-COVID medications emerge to the fore, making treatment more effective. The U.S. Food and Drug Administration approved 2 antiviral tablets to treat COVID-19 for emergency use in late December, marking a significant step forward in the fight against the coronavirus, which has killed more than 5.4 million people globally since its discovery in late 2019. Paxlovid, a Pfizer oral therapy pill, was the first oral antiviral medicine to be approved for emergency use in the United States. Merck's antiviral tablet, molnupiravir, was licensed for use in people with mild to moderate COVID who were at risk of developing severe disease. As the year came to a close in 2021, the more transmissible Omicron variety developed, and cases have been on the rise around the world in recent weeks. The number of cases in the United States reached an all-time high last week. According to data provided by Johns Hopkins University, daily new cases in the United States reached a 7-day high of more than 265,000 on Tuesday. According to the data, it beat the previous high of around 252,000 average daily instances set on January 11 of last year. Following a spike in deadly COVID infections in Asia, South Korea said on Friday that restrictions would be extended. According to Kim, the top goal in 2022 will be to distribute vaccines to those who need them, especially those in poorer countries with restricted access. A really important point to make is that the Omicron is not the Omega, he added. We'll see more mutants and variants of concern, and ideally, we'll become more egalitarian in our vaccination use. Increasingly, vaccination supply will not be a concern. The question will be who will be able to get the vaccine into the hands of those who require it. Getting people vaccinated is going to be the key for 2022, Kim said, adding that a substantial number of people in low-income nations have yet to receive a single vaccination dosage. According to Our World in Data, about 58.3% of the world's population has received at least one dose of the COVID vaccination, but just 8.5% of people in low-income countries have received at least one dose. Kim also drew attention to a diagnosis gap in COVID-19's diagnosis stage. Increasingly, vaccination supply will not be a concern. The question will be who will be able to get the vaccine into the hands of those who require it. Getting people vaccinated is going to be the key for 2022, Kim said, adding that a substantial number of people in low-income nations have yet to receive a single vaccination dosage. He went on to say that countries must become far better at addressing such disparities. It's the sequencing of variants from around the world that allows scientists to see if a new dangerous variant is forming, Kim explained. Getting on top of it as fast as possible is critical if we want to open up, since we know that air travel spreads the coronavirus very efficiently. Thanks for watching. Please consider subscribing to the channel.